Welcome to Sports Medicine on Tap. My name is Brandon O'Line. I'm sitting at Neck of the Woods Brewing Company with my good friend Dr. Frey and our quickly returned guest, Dr. Bertha. Welcome back. It's like Cole's Cash. You got him on so quick, you got to go back to the store and use the Cole's Cash before it goes expired.
I suspect we're going to be seeing a lot of Nick Bertha here.
I appreciate it, guys. Thanks for having me back.
For sure.
Good old Tuesday night here at Neck of the Woods.
2 weeks in a row.
I know. We're on a hot streak. You better watch out. But it's good to come back, and it's always good when we kind of get in our groove a little bit. And we are blessed that although the Super Bowl is now over and NFL season is our quote-unquote heavy season is over, we are blessed that we have the Olympics now with so many stories, so many backgrounds, so many interesting things. And fortunately and unfortunately in this situation, we have a lot of media coverage for some significant injuries.
Right. One that we couldn't not talk about. There's just so many layers to it. There's so much interest.
There's a lot going on.
Right.
And we mentioned it last week when we had did our Super Bowl preview with our good friend Gino. We talked about Lindsey Vonn and her amazing trial that she was trying to come back after a recent ACL tear to compete in the Olympics. Unfortunately, ended very poorly or badly for her.
Yeah.
Kind of the worst case scenario in this situation.
Not the worst.
Well,
bad case scenario.
Very bad.
Yeah,
absolutely.
Glad it wasn't worst.
Yeah.
Worst.
And it's one of those things where in her event of the downhill race, it is so fast. She's going up to 80 miles an hour going downhill on skis, on all these different things could have gone wrong. And she had a pretty significant crash. She was treated and airlifted off the mountain, and then went and kind of had some surgeries almost immediately. So we're just going to kind of dive into the whole situation
for sure
and kind of go for it. As mentioned, she about 2 weeks ago now, I guess, back on January. Yeah, just about 2 weeks, 10 days ago or so.
Is that all it was? The original injury was only 2 weeks ago?
Yeah. It was super recent. It was like right before she was coming.
Right.
Yeah, it was like a week before. I think it was about January 30th, give or take. She was in Switzerland doing a World Cup race and took a crash.
Did you see the conditions on that day?
No.
Did you see it?
Oh, no, I haven't.
They were terrible. Like, you can't see anything.
Oh.
And and like, I think it was her last training run before the Olympics. Like, and of course,
that's how it happens.
Always.
Unfortunately. But yeah. So all right, sorry, I didn't mean to cut you off.
No. So then she went ahead and was obviously up in the air if she was going to participate, and then just a week after, she was on social media, posted videos of her working out. She did a trial ski run. I think she did that when we recorded the last time as well.
Right.
So she had a little bit of, she was moving okay.
Yeah.
She was reported that she's going to have a brace on the knee. And then she did a trial run.
Yeah.
I think her time was like 11th in the group of people who did the trial run.
Yeah.
And then when she went to go race,
she actually, I think there were two like time trials, whatever it is, and she actually finished third in one of them.
Yeah.
No, she was still very competitive. She was still doing very well.
Yeah. And when we recorded last week, she had just announced that, I'm going to race anyway. Like, I understand the issues here.
Right.
I've been told that, but I'm going to do it anyway. Like, I'm just going to do it.
Yeah.
I throw caution into the wind. I'm just going to do it.
And, it was reported that she's going to have a brace on her knee, which is, it's very obvious that she did have a brace on. And then she only went down about 13 seconds into her run on Sunday.
Yeah.
She kind of hooked her arm on one of the gates, kind of lost balance, and then had a pretty good crash on the mountain there, which ended up resulting in a complex tibial fracture that's her Instagram or social media post that I saw on Instagram. She said it's going to require multiple surgeries, and I saw some things today that she already underwent a second one potentially.
Already?
So I think she's already kind of like 2 under in that regard. So I don't know how to slowly start peeling this back, but we have so much to talk about, right?
I'd say let's start at layer number 1.
Right.
So she has the injury 2 weeks before the surgery, before the Olympics. She decides, I've been told that this is a bad idea. I'm going to do it anyway. Your thoughts.
Yeah, I mean, I think there's a certain aspect of, and I think a lot of people's questions, what is the responsibility of the physician?
Right.
What do we say to this? Is it okay for you to go back? And how often do we really say, no, you can't go back, you can't do your activity?
Yeah.
And I think this area, especially with ACL tears, is kind of a gray area because it's one of those things that, you're not going to, you don't have a fracture, you can get back, it's a soft tissue injury, but especially in the skiing world, you're going to be unstable, and we know that. And, I think it's hard because you can tell people the risks and you can say like, hey, you really shouldn't go back. I really wouldn't recommend that.
Right.
But just like you said, at the end of the day, if you decide you're understanding the risks and you want to go through that, I get it,
What do you think?
I think it's one of those things, like we mentioned it last week too, is like when you get to these pinnacle competition levels in the world of sports medicine, the Super Bowl, the Olympics that happens only once every 4 years, you kind of make those little risky gambling decisions of like, yes, we understand the risk. We lay it all out. You understand how this could end and it could not go well. But if you can show that you're at least functional to an extent and can do this, then I guess the argument is like, yeah, we could give it a try. But everything has to align perfectly. Everything got to go right for this to be a successful story.
Right.
And she was very close to doing that, right?
Yeah.
Like she even said it in her pretty lengthy post that, in the world of downhill racing, the matter of 5 inches can be catastrophic or the difference between winning a medal or not.
Right.
And in her case, it went to the catastrophic side of things.
Yeah.
And not the storybook ending, unfortunately. And then I think, and also we can talk about this too, is that the claim that she said the previous injury had nothing to do with her current injury, which is like...
I think we'll get there.
Yeah. Which is like, whoa, I don't know about all that. But I think pushing the envelope for something like this is warranted in these situations at times. And I think, she was able to ski. She did her trial runs with it.
Pretty amazing.
Yeah. Absolutely. I mean, it's amazing that she did what she was able to even with this going on.
Yeah.
But I do think it's a little bit of a misnomer. Like, she talks, a little bit about like how strong like she is. And I think a lot of people kind of purported this about like, I did a lot of this squat strengthening and I'm feeling good. But like, if people could just get strong and be able to overcompensate what the ACL usually provides, we'd be out of a job.
Right.
So I don't think that's a realistic expectation. And you can be strong and you can, be better, but it's not going to stop that.
It's still unstable.
Yeah.
And that's the problem. So, and I don't think a lot of the population realizes it, but oftentimes the pain from the injury for an ACL tear usually goes away after a week or two. Like it's not typically a pain issue going forward. It's a stability issue going forward.
Right.
And it's deceptive because you can get strong and you could be stable for straight line stuff. You can go for a run, you could work out, you can even jump, and there's a lot of things that you can do, and it doesn't cause a problem. But it tends to be more the twisting, pivoting type stuff, where all of a sudden then your knee buckles. And I think the big worry here, and I'm such a social media idiot, like just so unsavvy. I don't know what even the right terminology. Like I was reading some posts going into the Olympics, basically saying like naysayers, like shut up, like keep it to yourself, and the truth is that I would have loved to have seen her. Like
Absolutely.
she is, it's tough as nails, right? Like she just comes back after injury, and like it's nonstop and courageous as can be, and like fearless and whatnot. But like, there's also a point where you're just throwing caution into the wind. You can't pretend the injury wasn't there if the injury was there, because it didn't suit the moment. And if you're willing to say, all right, the injury's here, and especially early after an ACL injury, your knee is more unstable than 3 months later when it starts to scar in a little bit and you've had time. Like 2 weeks later, it's really still pretty stinking unstable. Right. Now, she's had multiple injuries in her knee in the past. Mm-hmm. She might have been somewhat arthritic already. Right. I assume, actually, she probably is. And that actually would help her in this situation, right? Mm-hmm. Think stiff old guy walking down the street, right? Like, granted, she's not old. By my standards, she's 40. But if the knee is already becoming arthritic, there's some stability more so than if her knee wasn't arthritic, because the arthritis actually holds it in place a little bit. So that may have helped her. But still, 2 weeks after an ACL tear, typically it's not going to be super stable. Right. If she was willing to say, hey, like I understand the risks here. This is incredibly important to me. I'm willing to sacrifice everything and do it. Fine. But like, you were risking everything. And by saying like, this is not a good idea, it wasn't being a naysayer, it was being a realist. This could be really bad. If you close your eyes and sprint across the street, you might make it, but you probably won't, and it'll probably be bad. And the kind of thing. And if you're coming down the mountain at 80 miles an hour, I'm glad your head's still intact. I'm glad you're not a quadriplegic. I'm glad you're not a paraplegic. Like, it could have been worse.
Right.
This sounds like a terrible injury. We're going to get into that a little bit because I'm not sure this wouldn't have been less bad if you had an ACL. I'm glad it was only this and not one of those other really, really terrible things. Yeah.
Well, I think at the same time too, like, and I don't want to pick on Lindsey Vonn, but at the same time,
I mean, amazing courage and
absolutely. Like, I think that she gave it her all, and I appreciate that, and I appreciate her hard work and her effort.
Right.
But there is a part of me that says, like, knowing you came in with an injury that is going to make you less than what you could be,
compromise, yeah.
It would have been better just to say, look, I'm going to sit out. I'm going to give someone else that opportunity as an alternate to be able to get in and do this. And I know that's hard, and I know from it's the Olympics,
right?
Like,
right.
I get that, and I'm not critiquing her for this, but
and maybe 30% Lindsey Vonn is better than the next person up. Maybe,
very well,
right?
Yeah.
Again, Brad Bernardini, one of our early podcasts, way back at the beginning, and I use the exact phrase because he used it as like are you going to be the best version of yourself? Yeah. And is this version of yourself better than the next guy? Yeah. And that's what it comes down to, right?
Absolutely. And I don't know the answer to that, so I don't want to bash her for saying going forward with it. I totally get it, and honestly probably would have done the same thing. But it begs the question.
Yeah. In watching the injury and watching the video of the injury, and Lindsey Vonn saying that the torn ACL had nothing to do with it. It's a matter of margin of error is like 5 inches, right? And I just happened to catch my arm against the gate, and that's what caused this. Do you fully believe that statement?
I don't know that I totally buy it. I mean, I think she's probably being cautious with that leg, probably not utilizing it to the same way that she would normally counter for things.
Yeah.
And I think there's probably an element that it does contribute to it. I don't know, let's be honest. When did we see her do that before?
Right.
She's been in many Olympics, many races. And
what do you think?
I think, I've seen some videos of like her racing post-injury, and she was landing differently. Like, she wasn't landing evenly. She was landing more on the ACL leg. Intact leg, and then the left leg was coming down secondarily. And in the injury, when it happened, she was turning right, which all the pressure would be going onto that that left leg, which is injured.
Right.
So like you're landing differently,
That's
and
exactly
again, right, the margin of error she's mentioned is 5 inches in this sport, where it can be much different. So when you're landing unevenly, that could shift you just enough to run into a gate or whatever the case is. And even if you run into the gate, not saying that with an ACL she would have been able to stabilize herself, because it looked like once you're in the air and your body twists. And
it's really
hard to go, and she was going at such a high rate of speed. But would she have been that close if everything was intact and she was good to go and everything was going smoothly, and she didn't have to worry about changing the way she moved her center of gravity to go around everything because of that injury?
That was exactly my thought. I think you hit the nail on the head. I felt like, and honestly, it was a right turn. She was going to the right when this happened. But I honestly think she was at risk. The same thing going to the left. But in watching it, it looks like her knee, the left knee, the injured knee, falls into a little bit of valgus collapse as she's making that right turn. And whether it slipped because it was unstable, or bringing the buckle a little bit because it was unstable, and did that impact her ski turning uphill, turning to the right just a tiny bit more, and sending her up into the air towards the gate? Clearly, when she hits the gate, it's all over. But I don't know if she hits the gate if her ACL is intact. Guessing she doesn't is the honest answer. I hate to say it, and so I know, and I get it. There are coping mechanisms at play here, and she's trying to, sort of justify, what happened. But I don't know. I don't think it's necessary. It's not my body, and she's a incredible athlete. She's super in tune with her body. So if anyone really knows that it didn't slip or it didn't buckle in that moment, it's going to be someone like that. But it just seems like maybe that played into it. It just seems like it was a factor.
I agree with you. It's one of those things. These very high-level athletes, they're very in tune with things, but at the same time, their skill relies largely on the fact that they do the same thing every time. They know exactly how it feels, and so that they can reproduce it.
Right.
And when things are different, maybe you're not reproducing it quite the same way you think you normally are.
Right.
I don't know. Like you said, hard to say.
And I think, it's also with that too is she had the injury, and then she did a trial run and did okay, and
Right.
her time wasn't the greatest. So you try to push the envelope and go a little faster, and then you try to ask that knee to do something that you really haven't done yet, and over the however long it's been, and then it has that episode of buckling or whatever, and you feel it, and you kind of just a little twitch again, right?
That's all it takes.
It's just that little moment of angle changes that ski, just changes everything.
Millimeters, literally, right?
Literally, right.
Yeah. I'm not a great skier, but I can tell you, millimeters means a lot.
Yeah.
Absolutely. I've never skied, but I was in Colorado last year, and the skiing injuries are a dime a dozen out there.
Yeah.
Stedman Hawkins, you're in Colorado.
But again, I think, like we've mentioned, like I applaud her courage and bravery to do something that many people wouldn't do, right? Like most people see that diagnosis, that tear of the ACL, the tear of the ACL and that MRI, and it's like, all right, that's it, I'm done.
It's over. Yeah.
And it's like not taking no for the answer is like that's applause to you.
Yeah.
And yes, if it ended differently, we would have a much different discussion.
Sure.
But I also think if it ended differently, the ripple effect of her being able to do such a high feat of like,
to be able to pull it off.
And defy the odds is like would have a ripple effect in our everyday life.
Downstream of
and it's like, well,
which is detrimental.
Like I'm glad I don't have to live in the world where I have to remind patients like, well, you're not Lindsey Vonn,
right?
And this is not that very similar scenario. This is
because all of a sudden a lot of people start thinking, hey, I don't need to do it either, and it's not a business. Like this is just a reality thing. Like, the knee, you might need to do it. So, and actually, I think that's a perfect segue because that becomes like, in my mind, the next layer of the onion to peel back to talk about. Afterwards, yesterday, we record on Tuesday nights, right? Like, and so I think she put it out yesterday on Monday. She put out a tweet, and I admire it. Like multiple surgeries. We're gonna get into that in just a minute.
Yep.
And part of the way she caged the tweet was like I had this dream, I went for it. My ACL nothing to do with it. I stepped up, I did it, I went for it. I encourage everybody else to chase their dream and do the same. And me personally, I felt like that was a little bit, I hate to say, an irresponsible message. I admire it. It's a uplifting, it's a inspiring message, but there's a little piece of me that feels like it was almost a little bit of an irresponsible message.
Yeah, I agree. I mean, it's your and Brandon's point. I think it's one of those things. It's a dangerous game to play where you start having people saying, well, I have this injury, but I think that I can work through it. And it's like, well, no, you're going to cause more problems and you're going to have further injuries. We know that people that have ACL insufficiency in their knee have higher risk of meniscus and cartilage injuries.
Other issues, other injuries.
And when you keep having those things, like that's going to cause its effect on your knee, and it's a big deal.
It's tough, right? Because these athletes have such a high popularity, have such a good platform, and then you get these people. Yes, I would love that this story is inspiring people to push the limits a little bit, but also understand that when you push those limits, there is a very good chance that something. The risk that may not outweigh the reward here.
Right.
Like, it would have been great to see her on the podium.
Amazing.
Really
what an extraordinary story.
Like an extraordinary story, defying the odds. And that's the beauty of the Olympics, right? You have all these different stories of all these people. And we have some that we're going to talk about a little bit later, too, that defy the odds. They do these great things. Stories. Like the human potential is like unmatched when these things. And that's kind of part of why I do what I do, because to see what people can do when they push the limit, it's fantastic to watch. But then there's also the flip side when they try to push the limit too much and something doesn't go the right way.
Right.
And now we're here having a discussion, and we don't see her on the podium. We see her in the hospital bed getting multiple surgeries now. And I think at this rate, I think it's safe to assume that she's going to be officially retired and not unretire after this. But we don't really know that.
Who knows? She is tough as can be. Like I don't know. And going back to the analogy that I gave a little bit earlier about like someone closing their eyes and sprinting across a busy street, like you might make it, and like I think it's a little bit careless to then turn around and say like, see, this is a good idea. Everyone should do it, right? Or if you don't make it, to say, it's because I tripped over a twig or I stepped in a pothole. Like it's not because my eyes were closed and I sprinted across the street. Like I think that it was amazing and gutsy and incredible for her to go for it. I think that to try to inspire others to throw caution into the wind at times, even when the odds are really, really, really stacked against you. In this particular situation, I can understand why she did it. There was so much on the line. But for most people, almost every single time, that's a bad call. That's a bad decision. So like it's maybe me nitpicking a little bit to say, but I would have loved the message to have been like, I knew all the risks. This meant more than anything to me. I was willing to risk everything. I was really like I wanted to make it happen. It didn't work out. As opposed to say, wasn't the ACL, you should try it. It's okay.
Yeah.
Like, I just felt like that was a bad message.
I agree. I think this is kind of one of those things, kind of the old adage, the road to hell was paved with good intentions. And,
Bingo.
It's one of these things. Like, I know we're trying to encourage people, push and everything like that, but this might not be the right time.
Yeah. That's right. And I feel like this is a terrible message I'm sending. Like it's not the popular view, right? Like people are like, what are you doing? You're like, why would you?
I get it.
I don't mean to criticize her. She's amazing.
Right.
But I don't want to see the next person get hurt.
Yeah. And I think with that, I'm going to a little bit of a story time here of a similar situation, not similar, but a story that when this happened, when I woke up Sunday morning and I saw the notification that Lindsey Vonn was airlifted off the thing via crash, I was like, oh no, this could be really catastrophic.
Right.
I couldn't tell you when I saw this documentary. There was an E60 called Downhill, the life of Bill Johnson.
They're so good, man.
So good, right? I honestly don't know when I saw this. It had to be at least maybe 10 years ago. I'm not sure. And this documentary tells the story of Bill Johnson, who is an Olympic skier who won the gold medal in 1984. And he won the gold medal in downhill skiing. He was at the top of his game. He won a couple championships in that time. And then, his life went on. And at the age of 40, he tried to make a comeback for the 2002 Olympics. Outside of skiing, his life was kind of in shambles. He suffered a very tragic loss to his young son. And then he got a divorce with his wife, so he kind of was like in this midlife crisis type deal. So he kind of went back to what I guess made him happy, and went for to come back for the Olympics. So in the 2001 race, he went downhill and had a really significant crash. And this is like what we said, like Lindsey Vonn is in a very bad spot right now, but this could have been much worse in that for the case of Bill Johnson, he had a pretty bad crash. He almost bit off his tongue. His mouth was filling up with blood, compromising his airway. Oh. He had a traumatic brain injury from that. He was in a coma for about 3 weeks post-injury. And then from there, he started to suffer from mini strokes. And then later on, and that was in 2001, about 9 years later in 2010, had a pretty massive stroke. Obviously affected his life going there. He was assisted living and so on and so forth. And then unfortunately ultimately died at the age of 55 in 2016 from, I forget exactly what, but at that time it was like his quality of life was very poor. He was assisted living. Yeah. I think he lost one of his eyes. Like all these different things happened. And I was like, as soon as this happened, like it came to my brain. I was like, oh my God, that guy. Who was that guy? So I started Googling it and found the documentary, looked up his information again, like kind of like refreshed myself on the story. Yeah. And it was like the same thing of someone trying to push the limits of like, yes, he could do it. Now, again, totally different scenarios. He's not coming back from injury. He was just kind of coming back to the sport, did okay.
Yeah.
But when you're not at the top of your game and you're not in peak physical condition,
big risks.
You run the risk. And when you go down a hill with gravity not in your favor at 60, 70, 80 miles an hour, and those crashes very much like a car crash, right? When you're driving 80 miles an hour, getting a car crash, it's pretty significant.
80 miles an hour.
It's fast.
Flying.
Yeah. Right. It's crazy fast.
Yeah.
And it just, part of me was almost relieved that it was just a leg fracture.
Right. No, legitimately.
And I don't try to make it sound like this isn't a significant injury, but when I was like, oh man, I hope she's not like in real bad shape and like.
That was the first thing I thought. Like oh no, please,
Because even the videos I saw, her head was on the slope, or she kind of tumbled and hit her head a couple times. It's like, I hope this isn't like again catastrophic, where it's like, it's not good.
Yeah.
But again, certainly could have been worse. And the story of Bill Johnson was. Again, I don't know. It just clicked in my brain. I mean, it's like, oh man, that's crazy.
And I hate to say we don't know. I hope it doesn't, but this could get worse. Like we're not at the end of the line yet. Like you said 2 surgeries now.
Potentially, yeah.
And then there may be more surgeries in the future. But yeah, like what an unbelievable story that is, and that's sort of the disastrous spiral unwinding that you dread.
Yeah, absolutely. I mean, we were talking about this before. Is some of these injuries, it leads to these soft tissue wounds and infection, and you don't know where things are going to go, and it can always be worse. And I totally agree. I mean, thank God it wasn't her head, neck, anything like that.
Right.
And I don't want to say just the leg, but like something that's more amenable, to fixation. So,
do you think that so? we know it was tibia. We know it was complex, so probably more, multiple fracture lines. The fact that it was a tibia fracture, we're not really sure. At least I haven't been able to figure out where in the tibia it is. And the fact that there's multiple surgeries here, do you think that this was an open fracture? Was it tibial shaft? Was it tibial plateau? Do you think there's a possibility this was a knee dislocation that needed to be reduced with the tibial plateau or anything along those lines?
It very well could be. My instinct and thought was that it was tibial plateau.
Right. That was my first.
That was my first thought of things, but it totally could be knee dislocation, unstable injury. The fact that, she needs multiple surgeries. Oftentimes we'll put people into a temporizing device called an X-fix, especially with tibial plateau fractures.
Right.
It's like an erector set that comes out of your leg temporarily.
Yeah.
But the fact that she's now had a second surgery and we're still talking about
fast.
Yes.
If it was plateau, that was X-fixed because
yeah,
you need to let that swelling go down.
Yes, absolutely. No, I totally. And that begs the question to me is if they're doing a second surgery effectively 2 days out. I mean, did she have a fasciotomy? Did she have compartment syndrome or concern for compartment syndrome?
Or was it open and this is the second
washout.
Debridement washout? Yeah,
absolutely. It does make me concerned of the soft tissue injury.
Was there vascular injury or yeah.
A lot of unknowns, but I mean, it certainly sounds like it's a big deal injury. But it's one of those things. A lot of these fractures, they play a secondary role to the underlying soft tissue injuries.
Yeah.
If you get a vascular injury, you have these wounds that start causing, what we call compartment syndrome or too much pressure in the leg.
Right.
That's going to be even worse because that's where all your function is.
The bone emergencies. Yeah,
it's a big deal.
So if let's say it was a tibial plateau fracture, do you think the ACL deficient knee was more susceptible to have that injury in the crash because she doesn't have the ACL helping to stabilize the knee overall? And this is we're really getting nebulous and like out there like we're just I don't know, we're just kind of getting
no I think it's interesting. I think to make a small tangent into things, you get this like phantom foot phenomenon. Have you seen this? Like where I think it was described by the people in Vermont. Like when people fall, you get this excess pressure on your leg there, and without having an ACL, if you're doing this fall back, your tibia is shifting forward. It's very possible that in this scenario where she's falling, that she has this, and either lands on this in a different way or it has more impact that goes through it. I don't know. It's just it makes you wonder if you get an increased amount of force on that tibia because you don't already have the ACL.
Right.
And then I also would put in there, too, that I think wearing the brace in this case added a fulcrum piece.
That's right.
Absolutely.
With this force, and then you have this rigid metal, likely a metal structure, and it could just be that's where the fracture is, right? Like the whole top of her tibia could have got cracked, like all the way through.
It's a stress riser.
Just because
she has this boot coming up halfway up the, 2/3 of the way, and the brace coming down a third, and you have this small area of bone in between, like. That's the stress riser. That's where all the force gets concentrated.
Right.
Yeah.
Do you guys use a lot of the ACL functional braces for patients after ACL?
That is a very controversial topic.
Typically, I see it. I mean, we do most of the time.
I will say I did. And for me, the pendulum has been swinging away from using them. I don't use them nearly as frequently anymore. But I used to say first year out, I tried to get everybody into them. And now I've kind of gone away from them. But it's a conversation I have with a patient. How about yourself?
No, I agree. I think it's one of those things. I think it depends on the athlete's level of activity, what they're trying to get back to, what their sport is, what level. And, if there's someone that's really highly competitive, maybe it's worthwhile to try it to give that little bit of awareness of the knee. But I think in your, quote unquote, average bear, probably not making a huge difference.
Yeah.
So it's funny, as much as I'm not super educated, but I'm relatively educated. I wore my post-op ACL brace for years.
Yeah.
And it just because I never wanted to
speak from experience.
And I never wanted to have that happen again, so it was my safety blanket. And I wore it, I don't know, probably at least 10 years post. And then I switched. I went to something lighter, but I still had need something on my leg just because it's there. And it was just my own little psychological thing. It was just like, all right, cool. Like hopefully this saves me from anything. But at the end of the day, I know in my brain that it's not going to change too much if something were to happen. But the comfort of it, I was like, I'll rock with it. I'll keep wearing it.
I think that that psychological aspect, though, is honestly probably the biggest benefit of the
Huge.
brace.
Yeah,
I
big.
think that knowledge of you're like, hey, I have something on my knee.
Yeah.
And you're aware of that, and you're like, I don't want to make it happen again.
Right.
To me, that's the whole benefit of the
Yeah.
brace, you know?
Yeah.
Right. And it's shocking that it can still be a controversial topic, right? Like you would think, like, don't you have this figured out already? But it's controversial.
It is. It very much is.
And I mean, I think I see it in both arguments too. Like I see, athletes like myself that were like, no, I need this on, and other ones like, isn't my year up yet? Because I can take this damn thing off. I'm
People
tired
hate
of wearing it, and
Yeah.
they don't like it. They
Yeah.
don't, whatever the case is.
Yeah.
And I've seen it both ways, and I can appreciate someone who says I want to keep it on. I literally understand. I get it.
Yeah.
Just wear it if that makes you feel better.
That's
And
why I
other-
say it's a conversation
Yeah.
with the patient. Because
Right.
and I used to be like, no, wear it. Now I'm like, you hate it. You feel like it's like throwing you off. Like get rid of it. Like no.
Yeah.
So it is very much. And some people like they want that security blanket.
Yeah.
They do.
Yeah.
There is, and for sure. So like, if someone wants it, like, yes, I will help you get one. And if somebody doesn't want it, like I don't force it.
Yeah.
So no, I think that's a great way to go about it. I think it's all the way, up to you and kind of how you're feeling. I mean, the fact that you wore it and you felt good in it, I think says a lot. Like,
I got used to it. It was just part of what I did. And I had it on.
Suiting up.
And then, but again, like same thing, like we kind of mentioned a little bit too. And I think the psychology of the athlete or the patient, right? Like we have patients that are like me who need the security blanket. Patients like you mentioned who don't want it on.
Yeah.
And then there's patients like a Lindsey Vonn who knows she has a torn ACL. She's like, no, screw it. I'm going to still do it.
Yeah.
And she's going to go for it. And it's like, you're going to protect it and hope for the best. But I think she knew the risk and she was like, I'm still going to just do it.
Yeah.
And like, no matter what happened, she was going to go for it.
She was okay with it.
And granted, she had the brace on. But in situations where someone's not going 80 miles downhill, they're playing a recreational game or whatever the case, and they want to just go for it, and they say in their brain that they're okay, they'll be comfortable without it, or whatever the case is. But I think it's just the power of the psychology of the human, right? Like it just goes a long way in what they're going to be capable to do as well.
Yeah. I will say, after she had like the 2 training runs that worked, I was like,
Oh,
maybe she could pull it off. Like, like you start to, like, is she just like keeping her knees bent, keeping everything tight enough that it's not buckling on? Maybe she could pull it off. And
I mean, I think credit to her and like what she, as for some things I saw online, she was like, take a look at the standings and the odds of who's going to likely to place a medal. I'm still up there when I don't even have an ACL in my one. What's that show you?
Talk about courage and talk about like fearlessness. They have to be fearless, right? They are bombing
absolutely.
down at 80 miles. Like it's they're always like this close to like catastrophic disaster, but they do it anyway. Like there's a certain it's like Alex, what's his name, the free solo guy,
guy, right?
The skyscraper, There's a screw loose. There's something. They're not your average individual. There's a certain level of fearlessness and recklessness. Bordering on recklessness. I'll say it like that. But yeah, just amazing what she's done throughout her career.
Yeah. So just to go back on what we mentioned before briefly about her multiple surgeries, I just did a quick AI search. Again, credibility to this information is take it as you wish. But first surgery on Sunday, the February 8th. Was performed in the afternoon. This is an orthopedic procedure primarily focused on stabilizing the complex tibial fracture in her leg. Yeah. Second surgery.
Did they fly her home? She's still
no, she's
Italy?
in Italy.
Okay.
I think I was also reading another article earlier that I think some of the doctors that she's worked with in her career also are
there.
Also in Italy.
Yeah.
So they're the doctors who know pretty much all of her injuries in her knees inside and out literally were there to help her. So I think that may have helped. Then Monday, yesterday, surgery conducted less than 24 hours after the first operation. The goal of this second procedure was to manage swelling and protect blood flow to the leg, complications that can often follow high energy orthopedic trauma.
Compartment syndrome.
That's unfortunate. Yeah.
I think that's what it was for sure.
And then, again,
kind of should have just released it the first time through.
Yeah. Probably. It sounds like they probably were trying to avoid it. Yeah. And then it came back and bit on them. And that's hard because we talked about this. I know you have lots of fasciotomy related type things that you do.
I do have something in the works as well. Yes.
But it's hard because the reality is a lot of this is a clinical diagnosis. You can there's a pressure device, but usually it's kind of based on people's symptoms.
It's only a piece of the puzzle. It's not you can't just rely on that.
Yeah. There's a lot to it. So I'm sure they were watching. I'm especially in her. I'm sure they were watching it very closely, seeing where she played out to, and it just. They were trying to avoid it and just couldn't. That's unfortunate, but it's the best thing for her, honestly.
I have to imagine if she, what I take away from those two pieces of information, one, it wasn't an open fracture. Of course, I don't know that for sure, but that's just my first thought. And then two, it probably wasn't a knee dislocation. It was probably a bad tibial plateau fracture. Because I think if it was a knee dislocation, they probably would have done the compartment releases right there and then in the first surgery, is my guess. But they just try to get her past it without it. Oftentimes you'll be okay get by without it. And unfortunately, if that question is this the developing compartment syndrome comes up, you just got to do the releases. You just have to.
Yeah, absolutely. And this is one of the most common injuries that we see that need compartment releases. Yeah. Unfortunately, I mean they're very significant injuries. There's something that we see from a high energy mechanism,
right?
That again leads to a lot of soft tissue injury. And like I said, the bones are important, but they're only a piece of the puzzle.
Right.
And I think another thing too is if you need a little bit of a visual idea of what this looks like and how these complications can go with these complex fractures. Another E60 that you can check out is the one on Alex Smith.
Yeah, I was about to go there.
And, I think I watched that a couple years ago, and all the things that he went through, all the infection and all the other things that, like, the complications of just surgery could happen.
Yeah.
But, granted, I don't know the sanitary level of snow on a mountain compared to an athletic turf field and what the difference is and how that affects things. But, I think an example like that just shows you how all the things could potentially go wrong and all the longer road to recovery that could take.
And it always seems to be the high-profile cases that go awry like that. Man.
Yeah. Absolutely. And that's unfortunately for her. That's probably a long road ahead. That's probably another couple surgeries. Honestly.
Yeah. But in the end, she'll theoretically, right, like put the knee back together. It heals. Arthritis, if she doesn't have it already, is not far down the road.
Right.
In all probability, she'll probably wind up with a knee replacement, but she'll have a good, happy life. Like you know what I mean?
Absolutely. Absolutely.
Like she'll still go on. Life goes on. She'll be active. Maybe not quite as active as she may want to be, but she'll
she'll get back. She'll return to good function,
right.
And she'll have a good relief of her pain. So.
And I think also to note too, based off her injury history too, it's not the first time she's fractured this tibia either.
Yeah.
So I think that adds to the puzzle too. It's just like
sure.
It's not the original prototype, if you will. There's a lot of healing and stuff already done to it, whether it be weakness in certain areas or whatever the case is. But
think of that. Well, the level of just guts it takes, right, to get back up to the starting line, to get back to the the little whatever it is, a little gate that they push off. With all of those injuries in her past, knowing what she needs to do, and knowing how fast she's going to be going down that mountain, that if she does wipe out, like you're probably facing this whole long haul once again, and man, it's again like you marvel. Just a certain level of courage.
Average human was like, nah, I'm good. The average person probably says no, but these elite level athletes who just do these incredible
partly
things.
Why they're there, right?
Right. Yeah. It's why they're the best in the world in what they do.
So let's talk about Chloe Kim.
Let's go to another American Olympian. Why don't we? But before we do that, just for the American part of it is that we still placed gold in that event with Breezy Johnson taking home the gold with that. So not the American we thought was going to end up winning the whole thing, but someone did.
Yes.
Thank you. You're absolutely right. Did not ignore that point.
Yeah.
And well done. Yeah.
With that too is again these we mentioned too, just to kind of wrap up this Lindsey Vonn discussion with this downhill skiing too, is that the woman Sofia Gaggia, I don't want to butcher her name, won bronze in the downhill as well. Also had a tibia fracture back from a crash in 2024.
Yeah.
2 years later, here she is, and she's also good friends with Lindsey Vonn. Apparently, I assume all these athletes kind of know each other pretty well because they're always competing against one another.
Circuit,
right? It's a small circuit, right? Also came back from a crash of that nature. And again, these women, these men, these people who know the risks still line up after all the pain and all the suffering and all the rehab and everything. They still go out there and do it.
Yeah.
A credit to them again. And now we shift our focus as well to another American, Chloe Kim.
Wait. I have to ask a question.
Oh, yeah.
Do we see Lindsey Vonn in another world championship or another Olympics?
That's a great question. I think it depends on how things continue to go with this current injury.
She has a partial knee on the other side already.
I know. Which is honestly begs another, a whole other topic of discussion.
Yeah,
but
right.
I don't know. My gut tells me this is probably going to be kind of hanging it up. And I believe she's 42. I believe
she's 41 now, but
40,
either way, 45 by the next Olympics would be a tough. I mean, granted, maybe 2 years down the line she competes in a world championship just to do it and go down again. And
I think it's a hard injury to come back from, and I think part of the problem too is when you have these fractures, especially we're assuming tibial plateau, they often go on and get more arthritis.
Very.
And the other thing too is getting a partial knee replacement. Typically that alters the sensation of your knee, and in those elite athletes, that's changing the way that they feel, and that plays into things. And I think she accommodated the first side very well. Yeah. But I mean, certainly there's restrictions if you get a full knee replacement. I don't know that she'd be able to really get back to it anyways.
Yeah.
So.
Yeah. I have my doubts, but I guess if anyone's going to pull it off, we know who's going to pull it off.
100%.
We're wishing the best for her. So good luck to her.
Absolutely. To shift our discussion a little bit here to Chloe Kim, another USA athlete in the half-pipe snowboarding event, who, unfortunately, when this show's released, she would have already competed. She competes tomorrow, which is Wednesday the 11th. But back in January, she had a fall during a training session, and she dislocated her shoulder, which resulted in a torn labrum. And she's reported that she's going to be wearing a brace for the Olympics to help stabilize the shoulder, if you will. And she'll still compete. And Chloe Kim is a great, phenomenal athlete. She's been doing
two Olympics already, right?
I
two
believe
goals,
so,
I think.
yeah.
She was like a kid, the first one.
Yeah,
right?
She's pretty young.
Still a kid.
Yeah.
But I think this injury is very interesting because, again, in the world of controversy, these are very controversial injuries as to what you should do and when you should do it. And I think in the world of snowboarding, skiing, those kind of things where you're not necessarily using your upper body as much to do your activity, I think it's probably more reasonable to try to get back and do your sport.
Without a question.
And because I think the reality is probably if you're going to dislocate this, it's probably from such a big event like falling on it or something like that I think whether or not you're repaired that or not, it's probably not really going to make a big difference for you.
Yeah, and I just double checked it too. She's 25 years old. She's a 2-time gold medalist. So she's competed, I think, in 2 separate. So she's been doing it since she was 17.
Yeah.
And I think she, it's like you said, it's one of those things where this is not her primary engine for her sport, right?
Right.
Yeah.
And in theory, if all goes well, she's not falling again.
Right.
Right. And so there shouldn't be any.
Tough to rely on that, though.
Yeah. Right. Again, like we mentioned, Lindsey Vonn thought the same thing and went, south for her. But if all goes well, she shouldn't have any extra force on the shoulder. Hopefully, no instability episodes, anything like that happens.
I think it brings up a really good question, and I'm kind of curious to get each of your takes on it. What have you seen from other docs and their recommendation, and what's your sort of general guidelines? But first time dislocator, maybe with a labral tear, maybe the shoulder's not super loose. Lots of times, let's say even in a scenario where there isn't a torn labrum, but it's a first-time dislocator, like we don't operate on that right away oftentimes. And that's a little controversial, but if they feel pretty good and it doesn't bother them and it feels pretty stable, how long do you see people normally waiting before they will get back into sport?
So it goes...
And she's a month out.
I think a month out isn't unreasonable to go back to a sport where you're not necessarily using it. Where a sport like, say, football, which is my bread and butter, if you will, it's a little different because you're going to have a lot of force put on the shoulder at some point in time in a football game. It's the nature of the beast.
It's just going to happen.
Yeah, and pending your position, like, say it's, a Baker Mayfield situation, your non-throwing shoulder as a quarterback, likelihood of you getting hit is a little less than, say, a lineman or a running back or someone who's always going to get that. But once they feel stable enough and that you can brace it, it could help.
Yeah.
But, the paradigm can shift in that, you could do that, but then they have another episode. It's like, okay, now we struck it again.
Then that changes everything.
That changes everything.
Right.
But I've I've talked to different physicians where some people I've heard the discussion of first time dislocators, just get it fixed, get it done.
Yeah.
And then I've had others where
Pendulum is swinging a little bit.
I think it's a little, you can look at it both sides, and it's like, someone who's chronically dislocating, who's like, okay, here it is. It's Joe Schmo again. Here we are dislocating. Let's put it back in. And a couple minutes later, he's good to go and he's back out there. And and I've had those two where it's like, all right, we've pushed the limit too far. We got to get this fixed.
Yeah.
I've also seen it where it's like, it's too early. Like if, say, someone's 2 years into a 4-year college career, you get it fixed just for the third year for it to start slipping out again. It's
right.
Yeah.
Yeah, I think it's really interesting from a historic standpoint, because I think if you go back 20, 25 years, no one's getting surgery for these the first time.
None.
We're treating all of these people non-operatively, and like you said,
prove it.
It's like we've shifted that paradigm, I think, to saying like, okay, maybe more people really need a first time repair, and I'll be honest, I think I'm probably on the more aggressive side of this, but I think it depends on the athlete, the age of them, whether how many dislocations they had on it. So we're saying this is a first time dislocation, whether or not they're really hyperligamentously lax, what the sport they're trying to get back to is, and what their function in that sport is. Because those contact athletes, I mean, the rate of having your shoulder dislocate, like you said, in football for someone that's a contact athlete is so high, and the detriment of having your shoulder dislocate multiple times is big, because
it impacts outcomes.
It does. And the more you do it, the worse the outcome can be, and you can start losing that bone as it chips away there.
That's right.
And you get into a much bigger problem, a much bigger surgery, and a lower rate to return to what you want.
Right.
And in my opinion, I think there's a lot of these athletes, especially contact athletes, maybe you can try to get back for your season, but when your season's done,
fix it.
Yeah.
Right.
Absolutely.
Right. If you're going to try to get someone back to finish out their season, about how long would you usually make them wait? Is there a number? Is it a functional testing? Is it the way they feel? Like, what are your guidelines?
Yeah, I think I don't necessarily think it's a number per se. I think it's one of those things. I mean, I probably at least a week, if not two, kind of giving them some time to really let things scar in, start to get normalized from that standpoint.
Right.
Getting back into a strengthening aspect. I think one of the things that's hugely important is the way that they experience that apprehension.
I know.
And it's one of those things. It's a little bit more subjective because everyone experiences it differently. But I think that guides so much treatment. And honestly, I use that for our we'll kind of say our laymen for deciding whether or not we're going to do anything moving forward, because I think if they get to 6 weeks and they can go back, and granted most of these are anterior dislocations, they get back and they're like, I don't feel any apprehension. We're not doing anything.
Feel better. Yeah.
So, I think my hope is, getting people back in kind of 3 to 4 week time frame, be able to start returning things. But again, that's in like your really high level athletes that have the resources and the time to focus on their training and strengthening. I think for your average person, probably closer to 6 weeks.
I tend to like 4 to 6 weeks. I do. I go a little more slowly. And again, like you're saying, in more of a contact setting, like in this scenario, like this is it. The Olympics are here. You're doing it or you're not. And I can understand her pushing the limits. Fortunately, like you're saying, also, like it's snowboarding. Like if she does dislocate again, it's terrible. She's out. There's always a small risk that. I don't want to even say small. There is always a risk that she dislocates again, that she impacts her ability to have the best possible outcome when it's all said and done, when she does have a surgery. So there is a little risk in going back and doing it. But if you feel pretty good and it's the Olympics and you want to take that risk, it's a calculated risk. It's certainly a much lower calculated risk than Lindsey Vonn was taking in trying to do what she was trying to do. I think that is a very reasonable calculated risk to take for her. Hopefully it doesn't impact her. Hopefully she doesn't dislocate again. If she needs to have it fixed, if she continues to have apprehension or continues to be symptomatic later on, fix it after the Olympics. Try to get you through it, and put her in, get in a brace. And you can even wear pretty, like there are different braces that we have access to. Some of them are like kind of less stabilizing. It gives you a little more freedom to do what you need to do. And some of them are certainly more stabilizing, but there are definitely sports you cannot play in the more stabilizing braces. So you can go with one of these like heavier braces potentially, which really does a better job holding your shoulder in, and like try to get through it. You know what I mean?
Yeah, absolutely. No, I agree. And I think her case in particular is interesting because, like, again, she in general really isn't using her shoulder to do as much of her activity.
Yeah.
I mean, honestly, part of, while in general, like contact athletes, I would say like we should fix it in her. I think if she gets back and she's like, hey, I don't feel that apprehensive and she hasn't dislocated again,
let her fly.
Yeah.
I think I'd let her go. Just see where it goes.
Make her prove it. Right.
Yeah. I think certainly if she, has more, that makes your decision for you. But
right.
I think for her, I think it's very reasonable just to say, let's see where it goes.
Do you think she stays away from certain tricks that she has to like kind of reach back to grab the back of her board in midair? Like, yeah.
That might be like, I guess, the limiting factor, right? Like in her case for returning to sport would be just functionality. Like if she has a good, like you said, good range of motion and can do those things without issue. But I guess there are maybe tricks in her arsenal that she's going to take out because it does put her shoulder at maybe a risk, or
those external rotation,
or depending on like what side of the half pipe she's on and how she's rotating, she might not rotate to that side, or it's going to change her, I guess, her routine going down the half pipe a little bit.
Yeah.
So I'm very curious to see. I mean, obviously, again, it's Winter Olympics, so she's going to be in a snow jacket for the most part. So we're not going to see what brace she's in.
Yeah.
You're not going to really see if she's going to be. I don't think you'll be able to really tell how restricted she is unless it's like blatantly obviously. But again, with about 4 weeks, I don't think it's uncommon for an athlete to come back from that.
No, it's not. It's not it's not that outrageous.
Right.
Yeah. No, absolutely. Totally agree.
And we don't know. Like again, we record on Tuesday night. Yeah. She competes tomorrow, right? Wednesday. Right. Yeah. So by the time we post it, we may be outdated. Like the story may be told.
Yes. Yeah. I was gonna say we'll see where things go. Hopefully, all good things for her.
I want to say that I think on Friday, when this show should be coming out, it's going to be the finals for her event too. So I think it's Wednesday then Friday type deal.
Yeah.
So it's curious to see. Hopefully that she's
in it
and she's gets another gold for her. That'd be great.
I hope so.
So to go again, just kind of close to wrapping up here, but just honorable mentions for some other crazy Olympic stories that I found in my searches to discuss. Another snowboarder like Chloe Kim, who's been doing this from such a young age. A Japanese snowboarder, Takuchi Tomoka. Sorry if I messed that up. This is her 7th consecutive Winter Olympics. She's been doing it for the longest time, which is just crazy.
Right.
And she competes in the women's parallel giant slalom, which is very impressive. And it's like she's the first woman to ever compete in 7 straight Olympics like that, which is super impressive. And again, one of those stories of the Olympics is one. It's so cool. And we mentioned Lindsey Vonn, getting up there in age, and that age could be a limiting factor. But Australia sent a snowboarder, Claudia Riegler, to the games. That's 52 years old. She races in the parallel giant slalom as well. Apparently, she was kicked out of she didn't make the team at the age of 30 and ended up coming back. And now she's on record as the oldest female ever to participate in the Winter Olympics at the age of 52.
Man.
It's truly amazing,
right?
What people can do and what they go through.
Yeah.
Even this old guy gets to say like, that's really freaking old.
Right. So it's just crazy, and it's one of those things, the beauty of sport, right? Of all these different stories of all these different athletes, all the things, all the trials and all the suffering and all the different things that they overcome to compete at this high level and peak at the right time.
Do you think the Japanese snowboarder who's like, this is her 7th Olympics, is like, oh, it's been 3.5 years. I guess I got to go back to work again. And just takes 3.5 years off between.
Right.
Not a bad gig.
But to be able to compete in such a crazy, dangerous sport too, just consecutively and just continue to be effective at it, it's very impressive.
Yeah, to be dominant for that long and be able to continue to compete, it's just so impressive what some people are able to do. I mean, it is remarkable what the human body can continue to go through, no matter the age.
Right.
Yeah.
I saw, this is way lesser of a story, completely going off the rails here. It really has nothing to do with sports medicine at all. But one of my buddies, he's a screenwriter, and like he'll talk about like he goes for the human story, like he tries to find the human angle, like the thought that everybody has, but no one really generally talks about, or what, and I got to say, one of the first gold medals was the Italian speed skater.
Oh yes.
And then to watch her, like she's a mother.
Lola Brigida,
that's exactly right. And then after she won, to watch her, it looked like people were trying to grab her to do interviews. Like, she's in Italy. She's just first Italian gold medal. I think it was maybe the second gold medal of the Olympics. Mm-hmm. And she's like, thank you, but I just want to see my son. I just want to see my family. Like it was really like, and to see like how much like that was part of like she just wanted to get and be with her family, and she even talked about it, right? Like going into it, like she almost quit. She wanted to be there for her family. She almost quit, and then I guess even in her race, she talked about like I'm going to the race. I heard them and I just dug deep. And and she took off.
Oh
and
my God, it was
and
impressive.
Actually, it bears out. Like when you watch it and see it bearing out in reality, that like the announcers are like, doesn't look like she has it, and then she finds another gear.
Oh my God!
And wins
it was
because she
so impressive to watch. So I watched it live. I think that was on Sunday.
Angle for the Olympics.
Yeah.
It's great. Yeah.
I think that's one of the best things of sports. You know, you get these stories and you get to see what people in the human spirit can do. You know, it's remarkable.
The human spirit, right? Like it's amazing. I still go back to the American cyclist 2 years ago. Like, oh, man, what?
No.
Yeah.
No, but to go back to the speed skater, it's like I was watching that live on I think it was Sunday or Saturday, whatever the case was, and I remember watching it. And
it was Saturday.
Her name, Lola Brigida, like she kept saying it, and the announcer was like, "It doesn't look like she's got it there." And all of a sudden, he's like, "Oh my God, here she comes!"
She just finds another gear.
She just took off.
Yeah.
And she caught up to whoever she was racing, and then she got the gold. And the story of like, she's 35, almost retired.
On her birthday.
Yeah, on her birthday,
Good for her.
35th birthday. Yeah. She has a 3-year-old son.
Yeah.
And he's in the stands, and her husband, and they're going crazy.
Yeah.
And then afterwards, you could see her. Like they were trying to pull her to the podium. She put the hands up. She's like, no.
I'm going to get.
I'm going to go find my son.
Yeah.
And then, all her post-race events, she's getting interviewed, and her son's like picking her nose, grabbing her face, and she's just in the moment of like, that's like the best moment ever. Like she did all these things, and 3 years after having a baby's also super impressive because coming back from that as well is like. Yeah. To be at such an elite level and just also be the best in the world at it, like, holy cow, hats off to you.
Yeah, I love those stories. It's great. Yeah.
It was absolutely a phenomenal event to watch. And just, again, this is the best part of the Olympics, to watch it. And then you get the announcers to give you those little back details and all the cool stories. And you pan over to the family who's been through X, Y, Z or do whatever. It's like, it's the best thing in the world.
Yeah, for sure.
Have you seen this thing? Apparently they're putting heart rate monitors on people.
Oh, my God, that's hilarious. Yes. Like parents, they're putting heart rate monitors on the athletes' parents, right? So you'll go and like you'll see it, and I forget what event. It might have been figure skating,
right?
And it was like the dad and the mom were sitting next to it, and like the dad was like at 120 beats per minute, the mom's sitting at like 55, cool, calm and collected. And then they knew they were on camera, and they're like, and they start smiling. The mom's heart rate just started spiking up. But man, it is hilarious to watch just to see like the live heartbeats of all the people in the like different people in the stands.
That is
very
funny.
interesting.
Invested,
piece.
Yeah, that's crazy.
But yeah, it was funny. I was like, oh man, that mom is just chilling. She's good. And then like, the camera's on. She's like, she started smiling, and it went right. Like, man, she knows.
You can't hide that.
No. So before we go ahead and close out our tab tonight, anything else for the show tonight? I think we took a good old deep dive in the whole Lindsey Vonn story, and again, I think we're all in agreement that we hope for a good recovery for her.
For sure.
Again, I think we'll equally all be very impressed if she does come back again at the age of 45, or whenever she's able to ski again potentially and do a world championship or whatever the case is.
Yeah.
But I think she proved to the world she's as tough as can be, and I mean, we'll see what happens, and hopefully there's minimum to no more complications with everything as she recovers, and that this is just a good motivational story down the road, and it's not something that ends poorly.
More good stories from the Olympics to come, I'm sure.
Absolutely.
Yes, hopefully more good things. Go Team USA.
Yeah, absolutely. Before we go ahead and close out our tab, we're just going to give a quick shout out to our sponsors, Neck of the Woods Brewing Company, giving us the best beer in South Jersey, and Timber Rail Production, helping us put this all together and get it out to you on social media, YouTube and Instagram. So give us a like and a follow on those, and we'll see you next time, folks. Be safe and go America.